9 early signs of kidney failure and essential tests to prevent dialysis. Did you know that over 88,000 people in the US are currently living with end-stage kidney disease, ESKD, commonly known as kidney failure? When kidneys reach this critical stage, patients must either undergo dialysis or receive a kidney transplant to stay alive. However, the odds of getting a transplant are incredibly low, with more than 100,000 people on waiting lists, and a staggering 87% of them waiting for kidney transplants. As a result, approximately 70% of patients with ESKD rely on dialysis to survive, an extremely costly procedure, amounting to over $40,000 annually per patient. The earlier kidney disease is detected, the better the chances are of managing it and improving quality of life. However, the tricky part about kidney failure is that it can often go unnoticed until it's too late. Many patients may not experience drastic changes in their urine, its volume, color, or even smell. Some may find themselves waking up at night more often to use the restroom, but this alone isn't enough to confirm kidney problems. Recognizing the symptoms of kidney failure is key to early detection. In this video, we'll walk you through 9 critical signs that your kidneys may be failing, as well as the vital tests you should be aware of to avoid dialysis. Additionally, we'll provide you with actionable steps you can take if you suspect any issues. Before we dive in, please note that this video is for educational purposes only. Always consult your healthcare provider for personalized medical advice and treatment. What is kidney failure? Your kidneys are essential for filtering waste and excess fluids from your blood. Kidney failure, or end-stage kidney disease, occurs when these vital organs can no longer perform their functions adequately. This is considered stage 5 of chronic kidney disease, CKD, where the kidneys are damaged beyond repair. ESKD is often a result of underlying conditions such as high blood pressure, cardiovascular diseases, or diabetes mellitus. The buildup of toxins in the bloodstream, known as uremia, leads to an imbalance of fluids and electrolytes, affecting your overall health. When left untreated, this accumulation of waste can result in severe complications. 9 warning signs your kidneys may be failing. 1. Persistent fatigue and general weakness. Feeling unusually tired, even after a full night's sleep, is one of the earliest and most telling signs of kidney trouble. This happens because the kidneys are responsible for filtering out waste products from the blood. When they start to fail, toxins like urea and creatinine build up in your bloodstream, which leads to feelings of exhaustion. In addition to this, your kidneys produce a hormone called erythropoietin, which helps the body make red blood cells. When kidney function declines, erythropoietin levels drop, reducing red blood cell production. This leads to anemia, a condition that makes you feel weak, fatigued, and short of breath. Fatigue from kidney failure is not just physical tiredness but a deep, overwhelming sense of fatigue that doesn't improve with rest or sleep. It can significantly impact your daily life, making even small tasks seem insurmountable. 2. Muscle cramps and twitches. Muscle cramps and spasms, particularly in the legs and feet, are often early indicators that your kidneys are not functioning as they should. The kidneys play a critical role in maintaining a balance of electrolytes such as potassium, sodium, calcium, and phosphorus in the blood. When kidney function declines, these levels become imbalanced. Potassium, for instance, is vital for muscle function, and if its levels become too high, a condition known as hyperkalemia, or too low, it can cause painful cramps and spasms. Additionally, low levels of calcium and high phosphorus levels, both of which are common in people with chronic kidney disease, CKD, can contribute to this issue. These muscle cramps are often more than just occasional discomfort. They can become frequent and interfere with your ability to move and perform everyday activities. Left untreated, these imbalances can lead to more serious issues like muscle weakness or even heart problems. 3. Swelling in the feet, ankles, or hands, edema. As your kidneys lose their ability to filter waste and excess fluids from your bloodstream, these fluids start to accumulate in your body. This often leads to noticeable swelling in your feet, ankles, legs, and sometimes your hands or face. This condition, known as edema, can make it difficult to wear shoes or walk comfortably. It happens because the failing kidneys are not efficiently removing sodium and water from the body. Over time, this retention of fluids can cause puffiness, stiffness, and discomfort. In more severe cases, fluid can also build up around your lungs, leading to shortness of breath, or around your heart, which can lead to congestive heart failure. If you notice persistent swelling, especially when accompanied by other symptoms of kidney failure, it's essential to consult a doctor as it could indicate worsening kidney function. 4. Changes in urination patterns. One of the clearest signs of kidney issues is a change in your urination patterns, as the kidneys are responsible for filtering and producing urine. You might notice that you are urinating more frequently, especially at night, a condition known as nocturia, or you may feel a stronger urge to urinate but find it difficult to do so. On the other hand, some people experience reduced urine output, where the kidneys aren't producing enough urine, despite normal or increased fluid intake. Your urine may also change in appearance, becoming darker or foamy, which indicates that proteins are leaking into the urine, a condition called proteinuria. Blood in the urine, hematuria, is another alarming sign, which could point to damaged kidney filters. It's essential to monitor any changes in urination, as these could indicate declining kidney function, infections, or other underlying health conditions that require immediate medical attention. 5. Shortness of breath. As kidney function deteriorates, it becomes harder for your body to maintain a healthy balance of fluids. This can lead to a buildup of excess fluid in your lungs, which causes shortness of breath. Known as pulmonary edema, this fluid retention in the lungs makes it difficult to breathe properly, especially when lying down. Additionally, the anemia associated with kidney failure also contributes to shortness of breath, as your body isn't receiving enough oxygen due to a reduced number of red blood cells. Over time, this breathlessness can worsen and become more frequent, making even simple tasks like climbing stairs or walking across a room feel incredibly strenuous. It's critical to address this symptom immediately, as fluid overload can lead to serious complications, including heart problems and lung damage. 6. Metallic taste in the mouth or bad breath. People with kidney disease often experience an unpleasant metallic taste in their mouth or notice that their breath smells like ammonia. This occurs because waste products that the kidneys usually filter out build up in the bloodstream, a condition known as uremia. Uremia can cause a variety of symptoms, including changes in taste and bad breath. Many people describe it as a bitter, metallic taste that makes food unappetizing. You might also find yourself eating less, as the taste of food seems off or unpleasant. In more advanced stages of kidney disease, this can lead to malnutrition and weight loss. Bad breath is another sign of uremia, as the waste products in your blood affect the salivary glands, leading to a foul-smelling odor. These symptoms, while seemingly minor, can significantly impact your quality of life and indicate that your kidneys are struggling to perform their essential functions. 7. Nausea and vomiting. As toxins build up in the bloodstream due to decreased kidney function, they can irritate the gastrointestinal system, leading to persistent nausea and vomiting. This is another sign of uremia, where waste products like urea accumulate in the body. Nausea may be constant or intermittent, and vomiting can make it difficult to keep food or fluids down, leading to dehydration and worsening of kidney function. In some cases, the nausea may be mild and only occur after eating, while in others, it can be so severe that it leads to weight loss and malnutrition. Left untreated, this buildup of toxins can lead to serious complications, so it's essential to seek medical attention if you experience frequent nausea or vomiting without any other apparent cause. 8. Itchy, dry skin, pruritus. Chronic kidney disease can cause severe itching and dry skin, a condition known as pruritus. This occurs because the kidneys are unable to maintain the correct balance of minerals and nutrients in your blood, particularly calcium and phosphorus. When phosphorus levels rise, it can cause intense itching that doesn't go away with moisturizing creams or lotions. The itching can be localized to certain areas or affect your entire body, and it's often worse at night, making it difficult to sleep. This itching is not just a minor annoyance, it can become so severe that it affects your ability to function in daily life. Scratching the itchy areas can also lead to open wounds or infections, further complicating the situation. If you notice persistent itching, especially if it's accompanied by other signs of kidney problems, it's important to talk to a healthcare provider. 9. Difficulty concentrating and confusion. The buildup of toxins in the blood due to failing kidneys can also affect your brain. People with kidney disease often report difficulty concentrating, memory problems, or feeling confused and disoriented. This cognitive impairment, sometimes called uremic encephalopathy, happens because the brain isn't getting enough oxygen due to anemia, and the accumulation of toxins is disrupting normal brain function. You may find it hard to focus on tasks, forget things more easily, or have trouble finding the right words during conversations. In more severe cases, confusion can progress to delirium or even seizures. If you or a loved one experiences unexplained confusion, especially when paired with other signs of kidney failure, it's crucial to seek medical attention immediately. Treatment options for kidney disease. Treatment options for kidney disease depend largely on the stage of the disease and the underlying causes. In the early stages, lifestyle changes are often the first line of defense. These include maintaining a kidney-friendly diet that's low in sodium, phosphorus, and protein, which helps to ease the burden on the kidneys. Managing underlying conditions such as high blood pressure and diabetes is critical since these are major contributors to kidney disease progression. Medications like ACE inhibitors and ARBs, angiotensin receptor blockers, are commonly prescribed to help control blood pressure and reduce protein leakage into the urine, both of which can slow the progression of kidney damage. Doctors may also prescribe phosphate binders to control phosphorus levels and erythropoiesis-stimulating agents to address anemia. For patients whose kidney function has declined significantly, dialysis becomes necessary to filter waste and excess fluids from the blood. There are two main types of dialysis: hemodialysis, which involves filtering the blood through an external machine, and peritoneal dialysis, where the body's own peritoneal membrane is used to filter waste. Dialysis is a life-saving treatment for people with end-stage kidney disease, but it also comes with lifestyle changes and requires regular medical appointments. In cases where kidney function has deteriorated to the point of failure, a kidney transplant may be the most effective long-term solution. A transplant involves surgically placing a healthy kidney from a donor into the body, allowing the recipient to live a life free of dialysis. However, this option requires lifelong use of immunosuppressant drugs to prevent the body from rejecting the new organ. Aside from medical interventions, a holistic approach that includes regular exercise, smoking cessation, and avoiding NSAIDs, non-steroidal anti-inflammatory drugs, is recommended to preserve kidney health. Treatment plans must be tailored to the individual, addressing not just the symptoms but also the root causes of kidney disease to prevent further decline. Diagnostic tests to detect kidney failure. Detecting kidney failure early is essential to managing the condition and preventing further complications. Several diagnostic tests can help identify kidney dysfunction before it progresses to irreversible damage. These tests measure various aspects of kidney function, providing a comprehensive view of how well the kidneys are filtering blood and maintaining the body's internal balance. Blood tests are among the most commonly used methods to diagnose kidney failure. Two critical blood tests include the serum creatinine test and the blood urea nitrogen (BUN) test. Creatinine is a waste product of muscle metabolism, which is typically filtered out by healthy kidneys. When the kidneys are failing, creatinine levels rise in the blood, making it a significant marker of kidney dysfunction. Normal creatinine levels range from 0.6 to 1.2 milligrams per deciliter for men and 0.5 to 1.1 milligrams per deciliter for women. Elevated levels usually indicate impaired kidney function. Similarly, the BUN test measures the amount of nitrogen in the blood that comes from the waste product urea, a byproduct of protein breakdown. Normally, the kidneys remove urea from the bloodstream, but in cases of kidney failure, the levels increase. Normal BUN levels range between 7 to 20 milligrams per deciliter, with higher levels suggesting potential kidney damage. although dehydration or other conditions can also elevate BUN levels. Another essential measure in diagnosing kidney failure is the glomerular filtration rate, GFR, which estimates how much blood the kidneys filter each minute. The GFR is calculated using creatinine levels along with factors like age, gender, and body size, giving a clearer indication of overall kidney function. A normal GFR is 90 milliliters per minute or higher, while anything below 60 milliliters per minute suggests chronic kidney disease. A GFR below 15 milliliters per minute indicates kidney failure, often necessitating dialysis or a kidney transplant to manage the condition. Urine tests also play a pivotal role in diagnosing kidney problems. A urinalysis is a comprehensive test that examines the content of urine for abnormalities such as excess protein, blood, glucose, or bacteria. When the kidneys are damaged, proteins like albumin may leak into the urine, a condition known as proteinuria, which is one of the earliest signs of kidney disease. Blood in the urine, or hematuria, may indicate infection, kidney stones, or other disorders affecting kidney health. Additionally, the specific gravity of urine, which measures its concentration, can help assess the kidney's ability to maintain water balance in the body. Together, these diagnostic tests provide valuable insights into kidney function, helping healthcare providers identify kidney failure at an early stage. Early detection through regular monitoring of blood and urine markers can lead to better management and treatment, potentially slowing the progression of kidney disease and reducing the risk of severe complications. In conclusion, recognizing the early signs of kidney failure can be life-saving. Symptoms such as fatigue, muscle cramps, or swelling should not be ignored, as they could signal worsening kidney function. Taking preventive steps, including regular checkups and following your doctor's advice, can help manage the progression of the disease.